Robotic hip replacement surgery is essentially the evolution of traditional hip replacement surgery, which itself has been a procedure that's been described as the most successful operation ever. Uses preoperative 3D imaging of the patient, coupled with cutting-edge technology to enable the surgeon to use a robotic arm system, which hugely improves intraoperatively the preparation of the patient's own bones and soft tissues, as well as the implant positioning for the final definitive implants as well. So with manual hip replacement surgery, the surgeon relies on specific anatomic landmarks to guide the position and placement of the stem and the socket components of the hip replacement. With robotic surgery, the patient has a preoperative CT scan. This builds up a 3D image of the pelvis and the hips, and from this, a very individual and personalized plan is created. Using that patient's own anatomy as a baseline. During the procedure itself, specific metal marker pins are placed into the patient, which have infrared arrays on them. This allows the robotic system to know exactly, using infrared cameras, where the patient's body and anatomy is in real time and in space. And it can detect if the patient or the body has moved at all, and then that means that the whole system can recognise that and move with it. Knowing this, the surgeon, who is always in control of the robotic arm, is guided to prepare the patient's bone exactly as per the preoperative plan, with an accuracy of within 0.5 millimetre. The hip replacement components are then implanted with the same level of accuracy. The surgeon has real-time imaging on the screen, showing the implant position and other measurements such as offset and leg length. During the procedure itself, there's little difference from a patient's perspective. The surgery may take a few minutes longer due to the placement of the pins and the setting up of the robotic system. After the procedure, patients will be up and walking, often the same day. Many patients will be discharged the next day or sometimes the same day. They're doing really well. In terms of any other differences the patient may notice, other than the time in theatre, they may notice that the incision is slightly different. There may be a small extra incision just above the main incision for that pin placement. And post-operatively, there's growing evidence to suggest that recovery is faster and post-operative pain is better with robotic surgery as well. So robotic-assisted hip replacement surgery is just as, if not safer, than conventional hip replacement surgery. The vastly improved accuracy reduces the risk of removing too much bone or damaging other soft tissues inadvertently. The effectiveness of the procedure is also enhanced due to improved accuracy, which can result in improved leg length measurements and lower risk of dislocation post-operatively as well. So robotic hip replacement has been in use for many years. The specific system I use, the Mako system, has been in operation now for close to 15 years. It's probably globally the most widely used robotic joint replacement system that's available. And globally, up to this point, 3 million joint replacements have been carried out with this system. The software and the hardware continually being upgraded to improve the system as well.